Doctors for Change is an organization of healthcare professionals and community members established in early 2006 that works to increase access to care and improve the health of all in our community through research, education, collaboration, and advocacy. We believe healthcare providers have a unique ability and responsibility to advocate with their patients for improvements to the healthcare system. Since its founding 11 years ago, DFC has become an educational resource and forum in which healthcare providers, students, and community members can advocate locally and statewide. Our programs and advocacy efforts fall under the umbrella of one of four focus areas: access to care, mental health, access to a healthy lifestyle, and anti-human trafficking. This past year, the Access to Care Committee partnered with the Houston Public Library for our Doc Days program, bringing physicians and students into Houston public libraries to provide information on healthy living, health coverage options, and cooking demonstrations. The Mental Health Committee offered trainings to area school teachers on how to identify students with mental health needs, such as attention deficit disorder and depression. And for the third year in a row, the Healthy Eating Active Living Committee hosted its annual Healthy for Life art contest for Houston area youth and created its first Healthy Living recipe and tip booklet from art submissions so kids could learn from their peers. Our Human Trafficking Committee offers trainings that teach healthcare providers and medical students how to identify signs their patient may be a victim of human trafficking, as well as how to safely intervene when a victim has been identified. They also bring together Houston area organizations working to end trafficking and raise awareness through partner events like Children at Risk's bus tours. This past spring, DFC began a partnership with Freedom Place, a recovery center for female child sex trafficking victims, to present monthly education sessions to the girls on everything from nutrition to coping skills. We believe advocacy is a key piece toward positive change. The call to advocate is interwoven into each of our program areas, and nowhere is this more apparent than during the Texas legislative session. This past year, DFC leaders mentored medical students in a health policy course called From the Clinic to the Capitol to develop policy briefs that were presented to the 85th Texas legislature on everything from immunizations to postpartum depression. We coordinated monthly advocacy days in Austin to give providers and medical students hands-on experience and to educate legislators on the impact of health-related legislation. In March, we had our largest visit since our founding, with over 60 healthcare professionals and students who met with 124 legislative offices. As we move forward into the remainder of 2017 and look ahead at 2018, clouds of uncertainty loom over the health of our Houston community and nationwide. Yet in these uncertain times, our shared hope for a brighter future inspires us to work together to improve access to care and give everyone the opportunity for a healthy life. By joining with us through your generosity of both time and funds, you will be supporting programs working at the root causes of our community's unacceptable health realities through education, advocacy, research, and collaboration. Together, our shared voice plants the seeds of change.